So what's all the fuss about ventilators? Well, there's about 8,000 ventilators in the UK and we are fast running out of them. Ventilators require intubation as well. So frontline anaesthetists and ICU consultants and other doctors, they are intubating patients. That involves getting some tools and putting a tube down someone's throat. Open your mouth, like that, all the way down. And when that's in your throat, you then have an open airway and you can be ventilated. What is going to be the alternative? So here's the oxygen cylinder. Can you put the mask on, please? This doesn't involve intubation, but it does involve an airtight seal. What you can do is you can have one end going to the oxygen, so the oxygen inlet from the tank over here, or from a walled piped supply, which all hospitals have, into one of the tube openings, and that will supply the patient with oxygen. On the other tube opening, you would have what's called a PEEP valve. What a PEEP valve does is it keeps the expiratory pressure to a certain set amount. In other words, you get the same kind of resistance and the same kind of pressures going in and out as you would do to prevent barotrauma. Barotrauma is when there is too much pressure going into the lungs. And if you are ventilated and you get barotrauma, that causes more medical problems. So we're hoping that this CPAP style of ventilation that isn't quite as full on as normal ventilation, but is much better than just the nasal cannulas for this kind of respiratory condition. So it definitely has a place in frontline coronavirus healthcare. Another thing we can do with the CPAP Scuba mask is we can add a slightly different kind of adapter, and within that we can put an inline filter into the mask. Now I know this is actually a PEEP valve for all you keen medics out there, but if this was an inline filter, you could then put it on top like that, put the inline filter in, and now this is a safe, airtight mask for healthcare workers to wear on the front line to protect themselves and their patients.
This I've changed and basically combined that same connection with the Wally Rennie mask Roomba component for the HEPA filters. These filters last up to a month and again are out of the line for any coughs, so that sort of thing. And the filters, nice and quick and easy, pop over the top there. Same standard FFP3 grey, means that ICU staff can keep safe there.